Welcome back. Infectious disease expert Dr. Zain Chagla joins us this Friday morning to discuss the latest on the pandemic and vaccinations and lots more. Thanks for joining us. Good to see you.
Hi, good morning, Bob.
We are somewhere around approaching 70% fully vaccinated in Ontario. What percentage do you feel we need to reach so-called herd immunity?
Yeah, I mean, it's getting harder and harder with more transmissible variants out there, right? And I think we are starting to see breakthrough cases amongst those vaccinated. Not that many, but enough to keep driving the infection. We heard from the CDC that, unvaccinated people and vaccinated people can both spread this around. And so, I really, the number that is going to be out there that will protect people that are unvaccinated by people that are vaccinated is becoming vanishingly small. And really, the biggest protection people can do for themselves is get vaccinated for their own personal protection. And realistically, until we get really into deeper populations, we're not going to see a number of people vaccinated that's going to necessarily slow down the spread of infection. What we will see is less people in the hospital and less people dying with more vaccines out there.
Right, and the lower youth rate of vaccination is a problem as well, isn't it? And they're very active.
Yeah, exactly. And I think we know school's going to start soon, right? And the biggest thing we have right now to deal with this virus is the vaccines. They keep people from getting sick. They do reduce the risk of getting infected. And again, if we have lower rates in high contact environments, we're going to see the problems with it.
Yeah. Now, Alberta is pretty much completely loosened all the restrictions. How much are they jumping the gun here?
Yeah, I mean, I think what Alberta is saying and doing is something that will likely come to most jurisdictions at some point in time. The issue is that every place in the world has dealt with an exit wave of people that are unvaccinated who are getting the Delta variant, some of them being represented in healthcare. It's not as uncomfortable as prior waves, but certainly, is something. The issue is there's nowhere else in the world that has given up isolation and quarantine requirements as part of mitigating that exit wave. And in fact, the United Kingdom surged their testing to deal with it as compared to Alberta, which is essentially turning off their testing and isolation. Yeah. So, this is going to be uncomfortable for healthcare. And it's coming, but it's way too early for this.
Well, we have time. I want to get into some research and some recent developments. BioNTech says it's developing an mRNA vaccine for malaria. This technology, how far-reaching? Well, what is the potential for it? I think BioNTech actually mentioned cancer at one point.
Yeah, I mean, again, the problem with vaccinations has always been finding the right target and making sure it's stable to get into the body. mRNA gives us a different pathway. All you have to do is find the right target, and the mRNA keeps it stable until it hits the body and gets it to the right cells. So, this is a technology that's going to advance medicine in a direction that we've never seen before. And I think we're talking about malaria, RSV, influenza vaccines, and a lot of potential even for therapeutics for novel diseases. So this is really, really exciting for what this comes in the future. And clearly, these vaccines are well tolerated for a significant amount of the population.
Yeah, sometimes it takes a crisis like this pandemic to accelerate that kind of development. Also, we've got a story this morning that, and this is something you're probably familiar with, viruses have been linked to Alzheimer's for a number of years, and the pandemic has created an unwelcome opportunity to study that as well, and the linkage with brain fog with COVID.
Yeah, I mean, look, we've always known that there's post-viral syndromes. We have never really looked for the preceding virus as much as we have in this era. And so I think we're continuing to learn what things are triggered by viral infections, because we have a lot of people diagnosed with COVID-19 and we see what's happening then in the future. Doesn't say this hasn't been happening in the past, but we are making that link more and more and more these days as we have such good testing for COVID-19. So again, lots of medical progress that's being made in a number of disease areas.
Absolutely. Hey, thanks for checking in with us, and we'll do it again next week. Infectious disease specialist Dr. Zain Chagla. Have a great weekend.
You too. All the best.